Everyone, my name is Shanmas Chua Baldivia and I am a student nurse from the NASCOST. And today I am going to perform the nasal installation. Nasal installation are used to treat allergies, sinus infections, and nasal congestion. The nose is normally not a sterile cavity, but because of its connection with sinuses, medical asepsis should be observed carefully when using nasal installation. Assessment: assess the nares for redness, erythema, edema, drainage. Assess the patient for allergies. Verify patient dose, route, and time of administration. Assess the patient's knowledge of medication and procedure. Assess the patient's ability to cooperate with the procedure. Objectives: to instill directly the medication into the nostril nares, to provide means for nasal evaluation, equipment, medication, dropper, gloves, tissue, and medication. Step 1 is gather equipment, check medication order against the original physician's order according to agency policy. This comparison helps to identify errors that may occur when orders were transcribed. Step 2, know the actions, special nursing considerations, and safe dose ranges, purpose of administration, and adverse effects of the medication to be administered. This knowledge aids the nurse in evaluating therapeutic effect of the medication in relation to the patient's disorder. Perform hand hygiene. Place the medication on a tray or move the medication cart outside the patient's room. Organization facilitates error-free administration and saves time. Transport medication to the patient's bedside carefully. Careful handling and close observation prevent accidental. Identify the patient by checking the name and identification patients in a medication band. Identifying the patient ensures the right patient receives the medication and helps prevent errors. Explain procedure to the patient. Offer tissue to patient and ask patient to blow his or her nose. Blowing the nose clears the nasal mucosa prior to medication administration. Have a patient sit up with head tilted well back if patient is lying down. These positions allow the solution to follow well back to the nares. Draw sufficient solution to dropper for both nares. Returning solution to a stock bottle increases the risk of contamination of the stock bottle. As the patient breathes through the nose, hold tip of the nose up and place dropper just above nares. About 1/3 of an inches, instill the number of drops in one nares and then into the other. Protect dropper with a piece of soft tube if patient is an infant or young child, avoiding touching the nostril drop. Breathing through the mouth helps prevent aspiration of solution. The soft tubing will protect the patient's nares from injury during administration of medication. Have patient remain in the position with head tilted back for a few times. Tilting the head back prevents the escape of medication. Perform hand hygiene. Assist the patient to a comfortable position. Evaluate patient's response to the procedure and medication. Evaluation. Patient cooperates with nasal installation of medication. Desired therapeutic effect is attained. Experience no adverse effects including allergies response and systemic effect or injury.